Hello friends and dear students, I hope all of you are fine. And I welcome you to the next video of the series of examination of swellings. In my last video, we had seen about the fluctuation test which was positive whenever there was some fluid inside any swelling. Now let us move towards the next test in this series, which is Transillumination test. This test is positive whenever there is some transparent fluid inside the swelling. Now, depending upon the transparency, the body fluids can be divided in two categories, transparent and opaque. Serum, saliva, CSF, lymph, urine, these are some common examples of transparent fluids which transmit light through them, while blood, pus, bile and some pultaceous material, they are in the category of opaque fluids. So, in these cases, the fluctuation test will be positive, but transillumination will be negative. While if the swelling has got some transparent fluid, both fluctuation and transillumination tests will be positive. The principle is quite simple and easy to understand. If you apply some light source over the swellings with transparent fluid, they will glow and give a positive test, while the swellings with opaque fluid will not glow and they will be transilluminant negative. And here are some common examples of transilluminant swellings like hydrocele, meningocele and encaphalocele, which contain CSF inside them, ranula, which contains saliva, and cystic hygroma, which has got lymph inside. And in contrast, swellings like hematocele, abscess, sebaceous and dermoid cyst, they belong to the negative category because the fluid inside them is opaque. Now let us see that what are the essential requirements to perform the transillumination test. Obviously, you need a light source, and most commonly used light source is a torch. But equally important requirement is of darkness, because you cannot be able to perceive the glow of the swelling in an illuminated room. Just like you cannot see the flame of a candle in sunlight. So here are some practical methods to achieve the darkness. Turn off the lights, pull down the curtains of the windows. But even if it is not working properly, then you can also use a paper roll made of a dark paper or a plastic tube, or you can even use an X-ray roll for this purpose. You'll have to make a roll of the paper just like the torch, keep it on one side of the swelling and see through it. So this will give you a local area of darkness, and that will improve your perception of the change or if there is any glow in the swelling. Now let me give you a few practical suggestions here. In this case, please do not use patient's X-ray to make a roll. That doesn't look nice. In fact, you should have a permanent X-ray roll in your examination kit. And secondly, if you are examining a child, then please be more careful, because children are usually more afraid of darkness. Now here are a few more examples of some transilluminant swellings in different parts of the body, and you can very well see that all of them are glowing in a dark room. Well, the student should not hesitate in touching their torch with the skin of the swelling, even if you are examining a scrotal swelling. You can sanitize your torch later, but this test will be of no use if you keep it even slightly away from the skin of the swelling. And that is why you should always have a torch in your examination kit. Well, nowadays our mobile phone has replaced many things, including the torch, but for this test, your mobile will be not of any use. If you are using a paper roll, then please keep it far away from the torch. Well, the reason is that with a paper roll, you see only a limited ring of the skin of the swelling. And so, if you have kept your paper roll very close to the swelling, then as you can see here, there is some glow of subcutaneous fat also. So, this glow may be wrongly perceived as the positive transillumination test. So, to avoid this fallacy, you should keep your paper roll on the swelling but away from the torch. Well, it's interesting to know that even the color of plastic body of your torch is also important, and I prefer that it should be of dark color. Well, I'm not talking about the color of the light, it's about the plastic body of the torch. Well, you see what happens that if you are using some light colored torch, like say of white, yellow or red colored, so what happens that even with the glow, the torch body starts glowing, and that may make your interpretation little difficult. But this problem is not there if the torch is of dark color. Say in this case it is black, so there is no glow of this part of the torch, and the only thing which is glowing here, which you can see, is the subcutaneous fat of the swelling. So you got so many choices, but prefer to have a black colored torch for this test. Now, one method to improve the perception of transillumination test is on-off method. Well, in some cases, the glow of the swelling is not very brilliant and it is somehow difficult to perceive by human eyes. So, in such cases, you can use this on-off method in which you have to rapidly turn on and turn off your torch. So, even if the glow is faint, this change in the glow, or I would say the rapid change in the glow, the chances are higher that your eyes will be able to perceive it. Well, this method is not required for the obvious and brilliantly transilluminant cases. It should be reserved only for the doubtful cases. And as we had seen in the case of fluctuation, here also you can get some false positive and false negative results. False positive means there is no transparent fluid inside the swelling, but still the test is positive. And the major cause here is that this glow is of fat and fluid over skin and subcutaneous tissue over the swelling. Well, this confusion is more common in fair-skinned and obese persons where the fat glows with the torch, and also in the pediatric age group, especially in newborns. And to avoid this confusion, keep the torch over the skin at some other place in the vicinity of swelling. And there also you will get a glowing ring around your torch, and if the size and shape of both the rings they are almost same, then most probably the glow which you saw over the swelling is because of the fat. And opposite to it is the false negative test, in which the swelling contains some transparent fluid but the test is negative. The reasons can be technical or natural. The technical mistakes, common mistakes are like if your torch is not strong enough or if darkness is not adequate. So, your battery should not be weak and there should be a perfect darkness in the room. And the other reasons are natural. The commonest one is darkness of the skin. If you are performing this test in a patient who has got some dark complexion, or you are examining some body part which is naturally having a darker skin, and the commonest example here is scrotum, then in such cases the interpretation will be difficult and chances of having false negative tests are higher. And in some cases, even if your swelling contains transparent fluid but the walls are thick and calcified, so they will not allow the torch light to pass through the fluid of the swelling, and the test will be negative. And in the end, let us talk about some interesting questions like whether the transillumination belongs to the category of inspection or palpation. Because in this test, you are touching the swelling with the torch or a paper roll, not with your hands or fingers, and all you are doing is you are observing the glow of the swelling. So why it doesn't belong to inspection category? Well, the question is quite obvious, but the answer is that yes, transillumination comes in the category of palpation because mostly, or I would say invariably, this test is done after fluctuation test. The fluctuation test says that there is fluid inside the swelling, and whether this fluid is opaque or transparent, that you will find by the transillumination test. So, because of this reason that the transillumination test is done after fluctuation test, and fluctuation is obviously a finding of the palpation, this test also comes in the series of palpation of swellings. So if the fluctuation test is positive, then you must do a transillumination test. But what about the cases where fluctuation test is negative, whether you should perform a transillumination test or not? Well, this is also a logical question, and my personal answer to this question is yes, you should perform a transillumination test. Well, I hope you remember that we had seen in our last video that there are several cases where fluctuation test is false negative, means there is a fluid inside the swelling, but still this test is negative. So if the fluid inside your swelling is thick, or it is very tense, or the swelling is very large, this test will be negative. And in other words, the absence of fluctuation is not a guarantee that there is no fluid inside the swelling, and if you don't perform a transillumination test, you will miss it. So the message is that if your swelling is firm in consistency, and even if the fluctuation test is negative, there is no harm in performing transillumination test over it. So that's all for this video. I hope you liked it. Please share it with your friends and subscribe the channel. We'll meet again very soon with another video on the series of palpation of swellings. Till then, stay healthy, stay safe, and always keep learning in life. Goodbye.